got that cherry bomb.
Welcome to the show, Dr. Chang.
Thank you so much for having me.
So excited to have you here. We were just talking off mic about how we had some lovely cocktails last time we were in town.
Yes.
And we finally have a chance to sit down with you on the mic. And I wanted to ask you, since there is this rise of the undetectable era, have you noticed that you're getting more people interested in plastic surgery and like maybe less people going for all the filler and Botox? Or is that just me? Because that's been like, if I look back at my last year, I had basically no injectables, but I had blepharoplasty. So is that widespread or am I alone in that?
No, that's a great question. So one thing in general with quiet luxury, and that's always been kind of my ethos with plastic surgery, I feel like natural is always in. You know, a lot of people are trend-based surgeons, but that's not what I do. And so this is kind of great for me right now because that's always just been how I view plastic surgery and how I do it. I would say that the difference is not so much that people aren't doing as many injectables, but I think people are a lot more knowledgeable about what surgery can achieve and how it can still look natural. Because I think a lot of people, when they'll steer towards injectables first because they're worried that they'll look either strange with surgery or it's too invasive. But I think a lot of people now understand that plastic surgery can be really, the way I do it especially, is restorative. So you're putting things back to where they used to be. So I think the fear of looking like a completely different person has been quieted a lot.
Yeah, there was definitely for a while, we talked about this, that kind of like plastic surgery face that, you know, so many people started to look alike, and it was kind of like inflated and it was just like a certain look. And I think that's starting to wane, which is good to see.
Definitely good to see. So we're definitely seeing, I would say, trend-wise for the past year or two, definitely an increase in people asking to dissolve their filler, using less filler. I never have loved filler in general. So I have never been a proponent of putting too much filler in one setting. But we're seeing a lot of that, reductions in BBLs, downsizing of breast implants. So that trend, you know, we've really seen over the past 2 years, but definitely increasing this year.
Yeah. I've heard of the ballerina breast. Is that like a thing? They're like smaller, basically.
I think it's smaller. It's just like a media name. I think people have given it, but just a smaller breast without so much superior pull fullness, which was a look that a lot of people liked for a really long time, but that does not look natural. So.
Yeah, for sure.
And what about this technique we've been reading about called Jellyroll Botox? Have you heard of it?
Yes.
Okay. It looks interesting as maybe a lower bleph kind of alternative. I don't know. What are your thoughts? Is it a do? Is it a don't?
So the jelly roll, just for people who don't know what that is that little roll that people get when you smile right underneath the eye. And interestingly, this is very, it's almost dependent on where you are. So in Asia, it's called aigosal, and that's actually desired. But in the US, a lot of people don't like that. So what you can do, and it depends, there's different reasons that people get them. So they can it's either due to bunching of the lower eyelid orbicularis muscle, it can be due to excess skin, or it can be due to fat. So depending on what it is will depend on how you treat it. If it's due to muscle bunching, that's where Botox comes in. So I think if somebody doesn't like that, where they get kind of fullness under the eye when they smile, I think Botox is a nice treatment for that. Easy, just 1 or 2 units would help it. If it's due to skin excess or fat, then Botox wouldn't help it. So it kind of depends on...
Or puffiness.
Yeah.
Which is like the main things, right? Underneath the eye.
Then you need those patches.
Exactly.
It's interesting because there is a creator who I follow on TikTok, and she does her makeup very uniquely, where she always does like a little bit of eyeshadow under the eyes. She's Caucasian, but I was like, where is this coming from?
Yes.
So is that kind of
very common in Asia?
Okay.
So typically the way they do makeup in Asia is they will take like a light brown and they will outline the jelly roll and create a shadow under there.
That's what she's doing.
And it's supposed to, what it means in Korean, that word was it's supposed to be cute. Like it's like a cute
Okay,
thing that
yeah.
people like with the eye.
That's definitely what she's going for, because
Yeah.
then there's also the freckles and like
Right.
the highlight on the end of
Yeah.
the nose. And okay, it's all making sense now.
Yep.
We were talking about dissolving the filler, and I thought this was interesting. I was reading an article in Allure, and Dr. Few, who was quoted, said 15 years ago, I would have kicked any 40-year-old who was thinking about a facelift out of my office. But now he's seeing 40-year-olds who have overfilled and actually need a facelift. And he actually said, I do blame a handful of individuals on the medical side that have been proponents of mega filler sessions, putting in 20 syringes of filler in one session. And this is what has produced what we're now dealing with. So I'm curious if you do think that this kind of like movement is resulting, just like I was saying in the beginning, of like actually an increase in cosmetic surgery.
Yeah, I don't think it's that straightforward of an answer, but I think there's twofold. I think definitely when somebody is overfilled with 20 plus syringes, that can stretch out the skin. And when you dissolve it, especially if you're doing it after the age of 35, where your elasticity in the skin starts to diminish, then the skin isn't going to retract back to where it was. And then you will be left with excess skin that then, needs to be removed. So I definitely do agree with that. But at the same time, I think that even without filler, a lot of 40-year-olds who are coming in do actually meet criteria and are good candidates for facelifting. And I think that even without filler, they would have been good candidates for the surgery.
You yourself, who's become known for, the most natural, undetectable results
Thank you.
in Beverly Hills, but you also are a student of art history. You're a concert pianist. You've been educated and you have an appreciation of fine arts. And I wonder if, like, how much of that idea is even addressed when you're studying to be a plastic surgeon? Do you know what I mean? Because part of it is aesthetic. Like you're really,
what is that called? The golden ratio or whatever?
There is a golden ratio.
Yeah.
Right.
Yep.
Yeah.
which you may or may not agree with, but I don't know. Like, just maybe tell us a bit of background, because people do have different ideas of what would look good and what wouldn't.
Yeah, so I always use the analogy that my brother's an orthopedic surgeon, my uncle's a neurosurgeon, and when my brother is fixing a broken bone, he's plating it together, he's x-raying it, and it's done. Plastic surgeons differ in that there is this artistic element to it that's not just technical. How much are you lifting? What vector are you lifting in? How tight are you, making the sutures? What slope of the nose, will look good. And that's really personal, and that's really the artistic element that I think comes into play, which you don't really see with any other medical profession. And so with my background of studying art history, being a concert pianist, I think there was always for me an appreciation of the arts and appreciation of beauty. And so even when I was in, I think it was middle school, maybe 4th or 5th grade, somebody gifted me the Kevin, yeah, and a scalpel. I have always been good with knives. The Kevin Aquan makeup book.
Oh yeah,
making faces.
Forward?
I think
Making faces.
Yes. And I found that just so interesting, because through makeup, and you can create different highlights, you can contour things and change the shape of the face, and you can see what a big difference that makes. And I think my appreciation for understanding beauty and with art history, seeing how the concept of beauty has changed through different time periods. But then there's always constants there as well. So I think just having a personal interest in that always as a child, and then with the concert piano and playing that, I think it really allowed me to have significant improved dexterity. I started playing when I was 5, and I think that's really translated into my ability to keep incisions small, being really delicate with how I handle soft tissue healing, which is why my patients, I think, heal so quickly.
Yeah. And somebody said to you, they watched you and said, you should,
That's
like,
right.
you've got really fine hands and handy work, so you should go in this direction, right?
Right. So when I was in medical school, we were doing cadaver dissections,
Mhm.
and you're in a group. And we had, I think at that point, he was probably 80. He was one of the oldest faculty members at Columbia, and he was our anatomy professor who's been through generations of, surgeons that Columbia has put out. And he watched me dissect, and this was probably my second month of medical school.
Right.
And he's like, I think you're going to be a plastic surgeon. And
Okay.
at that point, it wasn't what I was thinking
Right.
at all.
Right.
But yes, so.
What do you think the hallmarks are of this sort of new undetectable era?
So how I've always thought about undetectable work, and again, this is what I've always believed in and done, is that you maintain somebody's essence. And that's what I think I'm known for, because even though I'm doing a lot of surgery on somebody, they don't look surgical.
Mm-hmm.
And I think there's multiple points to how that can be undetectable. But one of them is that they maintain, their essence. When you look at somebody, the brain isn't calculating, oh, is that crease too high? Is that brow too high? But it's just the feeling the brain gets when they look at somebody and whether or not that person looks and feels different to them. So I think there's that aspect of it. And that's definitely just something I'm not measuring, but it's just something like I'm eyeballing when I look at somebody and on the table. Then there's, of course, imperceptible incisions. I think that's really key. Nobody wants a noticeable incision and be able to say it's, I didn't have any work done.
Yeah.
Mm-hmm.
You're making it sound easy. It's not easy. And like, I feel like there is a face out there. I've seen it where it's almost like a bit like AI. It's a bit like paint by numbers. It's shiny. It just, it looks too tight.
We're starting to see.
Right.
So I mentioned earlier, like we don't have that plastic surgery face that we had 10 years ago, which was kind of that like walking down Fifth Avenue shopping.
Yeah, it was like the early adopters kind of came to roost.
But there is starting to be a little bit of a sameness. I'm sure you've noticed, where it's just like a bigger kind of Disney character kind of eye and like a heart-shaped chin. You know what I mean? Like there's just proportionately, it seems like there might be some of that sameness starting to come around. Yeah, and then it was like the Kardashian thing, and now it's kind of going into, I don't know, it reminds me of like a Disney princess look,
I would say with going back to undetectable plastic surgery and keeping somebody's essence, I try not to mimic anything between my patients, but it's really what looks best for that patient.
Yeah.
So I know what you're saying. I haven't really seen that in my patients, though, because I think
not in your patients, of course. Present company excluded.
Thank you. But sometimes a heart-shaped face on one person, like you're saying, where the bigger eye might not look better on somebody. So I did have a patient come in and they said, I want my crease higher. I want my eye to look, a lot bigger and brighter. And I actually told them I didn't think that was a good idea and we should keep their existing crease position. Because even if you lift the crease higher and it makes the eye look bigger, it wouldn't look right.
Right.
So I think, again, that's where that, counseling comes in and the artistic judgment comes in.
Yeah.
And then going back to your question about, what makes something undetectable, it's also the vectors, specifically for like facelifting. What vectors are you pulling it in? Because if you pull it in an incorrect or unnatural vector, it looks off because the face, doesn't lift that way. And I think something you said was incredibly key, which is that sometimes you see a really tight face, someone who's had a lift and they look really tight, but they don't look younger.
Yeah.
And I think that's also really key. It's not just about making somebody look tight. It's about, I think, making them look more rejuvenated, more rested. And it is normal to have a little bit of skin. 20-year-olds come in and when they do this, of course, they have excess skin.
Yeah.
So I think, it's not just about making sure someone's like perfectly tight with no excess skin.
Yeah. Sometimes you say no, it sounds like.
Yes. Yes, often.
Yeah. What percentage would you say that is that you say?
Well, to even make it to me, we actually have a 2 to 3 step screening process.
Okay.
So
Wow.
somebody has to make it through the screenings to get to me. And the screenings are a multitude of things that we look at. Sometimes it's aesthetic based. So if someone says, people sometimes when they request a consultation will send in a photo of what they want, or they'll say, a photo of themselves, and this is what I want with a morph. And if it's something that is definitely something that my team and I don't feel looks natural, they wouldn't even make it to see me. So of the people that make it to see me, probably 25% I, either don't take on or I, counsel to do something else.
Yeah.
Yeah.
That's a lot.
Mm-hmm.
That's a lot of business to say no to. So I commend you for that.
Oh, thank you. I mean, it's anytime you operate on somebody, it's a long-term relationship.
Yeah.
And so that's how I view it. Is it somebody that, number one, you have an easy way to communicate with, two, a similar aesthetic, and is this somebody you want for, years?
Yeah.
Right.
So.
Now, one major point of difference, as far as I can see, that you do in your work is custom facial implants. And you create these with CT scans, so they actually fit the face extremely precisely. They're really custom as opposed to, taking them off the shelf. So again, it's just like really enhancing. It sounds like almost like restorative of what this person probably once had. And I read that you also co-authored a textbook atlas of facial implants. So tell us about this, like who would be a candidate for this, and just tell us more.
Yeah, so custom facial implants are something that is pretty unique. Only a handful of surgeons in the country do it. And so what that is if we want to augment or change the facial skeleton through implants, this I think is the best way to do it because you can actually customize it to the patient's precisely. And so what we do is the patient gets a scan, it gets rendered into a 3D image. I then design the implant on the skull on the computer, and then that implant gets made, sterilized, and shipped to me. And
what is it made out of?
There's two different types of material. There's silicone or porous polyethylene. I tend to prefer the latter because I think there's better soft tissue integration. Most surgeons aren't as comfortable with that material, but as long as you know how to use it, I think it delivers better results. But if you think about someone's facial skeleton, which having, not seen it for most people directly, there's so many different contours. There's so many angles that are different between one person and the next. So expecting an off-the-shelf implant to match somebody's chin between two people, it's just, they never fit right. And then you also save a lot of operative time because you do a lot of the pre-planning, off the operating room table. As opposed to off the shelf, you're on the table carving the implant, shaving it down, trying to manipulate it to fit onto the skeleton. And so with facial implants, you can pretty much put it anywhere. So common places are the chin, which I love. I feel like almost everyone needs a chin, myself included. Jaw implants. So people who have a short, what's called the ramus, which is the distance from this bone, the vertical bone on the jawline, from the ear to the bottom of the jaw. That in certain people is really short.
Okay.
And so that can create a less defined transition between the jaw and the neck where people feel like their jaw blends into the neck. So with the implant, you can change both the length of the ramus, drop the jaw down.
I'm measuring.
I've got my short one or a long one. Let's see.
That's my ramus.
Not bad. And then you can change like the width. So for men especially, a longer and wider ramus tends to look more masculine.
I have so many questions. Now, one of the things maybe people don't realize is that your bone actually starts to kind of erode, right? Around your chin and jaw area. Like you start to lose it, right?
Just in general, as we age, we not only shrink in height, but our facial skeleton, there is bone resorption. So if you already had a weak chin to start in your teens and 20s, when you're in your 40s and older, you'll have even more recession. So there definitely is that.
Okay.
But the whole facial skeleton, not just the jaw, the rim,
it's
the
everywhere.
temples.
Okay. And now, is this something primarily men are having done, this masculinization, or is it like evenly split, or who's
actually
mainly
pretty
wanting
even?
this? Really?
So the chin implants, I would say, perfectly evenly split between men and women. And also a lot of women are initially worried about chin implants because they think it will make them look more masculine
Right.
because it'll look too wide or too
Mhm.
long. But that's the beauty of customization is I create these really tiny implants and they blend and seamlessly into the jaw. So there's no step off. And then you can make a 1 millimeter implant, 2 millimeters, 3 millimeters. So really small. That's like this big, but it makes a big difference.
Mhm.
Out of the box implants, sometimes the smallest size is a 5 millimeter, depending on what company you're using. So that is way too big for most women.
Okay.
For jaw implants, I would say that's 80% male.
Yeah.
Okay.
Okay.
I remember we spoke with another plastic surgeon. He was talking about how most people think they need a nose job, but they just really need a chin job
Yeah.
Yeah.
I
to
remember
balance,
hearing
because
that.
then you get the better profile.
Yeah.
And people are like obsessively looking at their nose, but they don't really think about the chin.
Yes.
So this is really interesting.
Yeah. So definitely looking when I assess a face and a nose as well, you look at the harmony between and the
Yeah.
proportions between the rest of the face, the chin, the nose. So a lot of people hyper focus
Yes.
on one spot. And that's why when people are focusing on like a line, I counsel them, no one is seeing that line
Yeah.
but you. But yes, that's very true. So you really want to balance the nose and the chin together.
Yeah. Zoom out, everybody.
Mhm.
I wanted to ask you about fat transfers versus implants.
Mhm.
If there are certain people who are candidates more for one versus the other. We've definitely had this conversation when it comes to breasts before.
Mhm.
And, some people want what maybe they think is more natural or that their body won't have like a reaction to.
Mhm.
So how does that apply when you're talking about the face area?
Yeah, so I think it depends on what somebody's looking to achieve. So if somebody has had volume loss and we're talking about just facial rejuvenation and restoring volume, I like fat. I think it
Mhm.
looks natural. It ages better too, and you're replacing like with like.
Right.
You can sometimes do filler depending on the location, depending on the amount, but I do tend to prefer fat.
Mm-hmm.
With implants, it depends on where, we're placing it. So if it's in the chin, I always prefer an implant over fat.
Right.
I don't put fat in the jawline. Some people do, but nobody wants like a saggy kind of jaw. And I don't think
Mhm.
fat is structured enough.
You're looking for structure. Yeah.
And which is why I also don't love filler in the jawline. So a lot of people do that, but I don't think it provides enough definition.
Mm-hmm.
And then in the cheek, it depends. If somebody is it's due to volume deficiency, then I think fat grafting makes sense.
Mm-hmm.
If I think it's due to skeletal deficiency, then that's where
That makes sense.
the implant comes in.
And I did go to an event where they were talking about a newer, I forget the name, but it was a newer filler that was like the most dense one on the market. I think it launched in Canada before the US.
Mm-hmm.
I think it was from Galderma.
Yeah. So you preferred.
I still do. I think
yeah.
even the most, so that's referring to G prime, which is how compressible a filler is.
Mhm.
So even the highest G prime filler is not going to be as effective as an implant.
Right. Which
So-
still feels real and everything, just like a breast implant, right?
Yeah, I mean, 100% of the patients that I've placed implants on, everybody says they don't feel it.
Yeah.
Yeah.
Okay.
So once it's in,
It's
in.
known as, if anyone wants to look it up, it's Restylane Define, DEF.
We have that one.
Okay.
Yeah.
Yeah.
I did have a question about the prevalence of these facial implants. Is this something you're seeing more of now in the era of weight loss, semaglutide medications? People are like losing that volume and they want to come in to you to fix it, or what? Like facial implants
Ozempic
seems
face.
kind of crazy to me. I'm sorry. Like putting a foreign type of object in your face to hold the structure that's not your bone. I just don't know.
So I would say that facial implants are much more common than you think.
Okay.
And
in Hollywood?
in Hollywood, in just
Models?
your models, your friends.
Right.
I think it's a lot more common than you think.
Okay.
It's
to know.
something
I'm not saying no.
that's
I'm not saying no.
even back in the 60s, people were replacing implants
Yeah.
in.
Really?
And at one point, people were using like goat cartilage, and we don't do that now, obviously.
Wow.
I don't think I've been seeing specifically semaglutides leading to an increase in facial implants, but I think with rapid weight loss, regardless of the cause, you can have skin laxity.
Yeah.
So we are seeing, people coming in saying, oh, they feel like their face is falling or it looks
Yeah.
looser than before.
Right.
Which is also true. When you lose fat, you lose the support under the skin.
So what are you recommending for those types of patients?
Yeah, so it really depends on what I'm seeing. But if it's really a lot of facial laxity, facial skin laxity, and soft tissue laxity, then face and neck lift.
Yeah.
Straight to the lift, everyone.
Straight to the
What is the Bijoux Lift? Because this is something that you developed and kind of coined.
Yes.
Tell us what that is.
Yes, I'm laughing because my operative team always knows anytime I'm operating on somebody and doing a Bijoux Lift, I'm very jealous because I want one. So they always laugh at me because I'm always like, oh, I really wish I could get this. So
you need to do that Severance thing where you like ding and like you're like the Audi Dr. Chang.
Yeah. And come
operating on the inner Dr. Chang.
That would be amazing, actually.
Yes. And by the way, unless you're watching this on YouTube, which you should be, Dr. Chang also could pass for 19. Like this is, but in a realistic way, in like a very natural way. This is what we're talking about.
Thank you.
She's on
thank
brand.
You. I started young.
Yes.
I'm on brand. Thank you.
Tiny tweaks.
Yes, and starting early. So the Bijoux is for my 20, 30-year-olds who feel like they are seeing facial aging, but don't have enough skin and don't qualify for a facelift, and also have already tried all the conservative treatments like lasers, radiofrequency, ultrasound-based, and skin tightening treatments, but they have soft tissue internal descent. So this is a 1-hour procedure. It's very quick. I make a small access incision in the scalp, so it's hidden. Then I tunnel down and essentially do a mini deep plane facelift. And so I lift the soft tissue. But these patients, when you're 20, 30, you don't really have a lot of skin excess.
Right.
You are starting to get descent of the SMAS, which is the internal layer that we want to lift.
Right.
So you don't want to put incisions around the ears in somebody that you're not removing skin in.
Now, would this be an alternative to threads? Well, like a thread lift or a ponytail
threads,
lift or whatever?
So it's a more permanent and better alternative to actually lift. I find that threads don't actually work, so not really an alternative. I think just people shouldn't do threads in general. Yes.
Right.
Yeah.
Well, the reason I thought of it is because that was really the first time that I think we as beauty editors heard of people in their 20s and early 30s, right? Remember when there was all that
like
speculation around
Fox eye lift and whatever.
We used to debate whether preventative Botox was really a thing. Now, is it when you were talking about surgery?
So I think the use of the word preventative is maybe not the correct word in the sense that doing it early doesn't mean it prevents you from needing a facelift down the road. But what I think early lifting does is there's a multitude of factors. But one, I think it allows you to enjoy the lift for longer. So a really key component of how long a lift lasts is how good your skin quality is. So if you have better skin quality, which everyone does when they're younger, because we know that collagen decreases by 1% in the face each year after the age of 25. So the younger you do it, the more collagen you have, which means the longer the lift will last. 2, your healing potential is better. So you recover more quickly. And then I think 3, as opposed to waiting until you're 65 for your first lift, it's a less drastic difference. So I think a smaller tweak, which you can enjoy for longer, is definitely much more appealing than waiting a long time, feeling like you don't look how you feel on the inside for a long period of time, then doing the lift and then, not having it last as long as if you were to have done it earlier.
Right. Because the quality of your skin is doesn't bounce back as quickly.
Exactly.
Okay.
So it won't prevent you from needing a facelift down the road, but I think people are much happier. So the patients that I have who've waited for some time and after they get their lift, they routinely say, I wish I just did this a lot earlier.
Yeah. If somebody comes to Beverly Hills to get a facelift, this sounds like something you would do in a movie. What are we getting? What are the extras you're getting?
Yeah, I mean, every practice is different, but with my practice, even if I wasn't in Beverly Hills, I think they would still get this, but they get really concierge care. So we really try to set up from beginning to end. We try to take care of and handle things for the patients. We get their scripts for them. We can get it delivered to their hotel, especially for our out-of-town patients. We provide transportation from the after surgery to the hotel, and then from the hotel to my office, and then from my office to hyperbarics, and from hyperbarics back to their hotel. It is typically in a Rolls Royce, which is nice.
Wow.
Yes,
so
this is what I'm
that's-
talking about.
Oh,
Yeah.
come on, girl.
You need more than
Girls' weekend
pennies.
gone
You need a jar full of loonies and toonies and a lot of $100
Loonies
bills.
and toonies. Our Canadianness is just being flaunted now.
But okay, Rolls Royce, tell me more. I'm in now.
I've never even been in a Rolls Royce,
Champagne?
but my patients have, which is nice. We don't allow people to drink immediately
Right, that makes
post surgery,
sense.
but if we could offer champagne, we would.
Right,
Yeah.
right.
Yeah, and then
Yeah.
they have 24-hour access to our team, to our clinical team,
Mhm,
Okay.
mhm.
which usually people don't need, but at least
Yeah.
we're there for
it's
them.
that peace of mind
Yes,
that
exactly.
you're getting. I did want to ask you, because I feel like a lot of people come to you for blepharoplasty,
Mhm.
and you've kind of pioneered this technique, have you not? Did we talk about this already?
The cat eye?
Yeah.
No, we haven't.
I want to know about it.
So I would say I don't do a specific cat eye
Okay.
exactly, because I do think that tends to look a little too aggressive.
Right.
Right.
What do you call it?
I actually just call it a straightforward blepharoplasty.
Yes, okay.
But I think what I do that's a little different. One, I think 99% of the people that come in are really worried about changing their eye shape.
Mhm.
Yeah.
And so I think the key is to not change, again, somebody's essence, which a lot of it comes from the eyes. So really maintaining the shape, but accentuating it. And so I think one component of, a blepharoplasty I don't like when I see these results are when the incision curves downwards.
Yeah.
And
This is on the upper eyelid.
on the
making
upper
like a half
eyelid.
moon
Mhm.
shape.
yeah, and so and I think this is, love my male surgeon friends. Nothing against them, but I think
Yeah.
one kind of benefit I have of being a female is that I
Mhm.
do use eyeliner.
Yeah.
Right.
And you want that kind of cat eye and what we call a positive canthal tilt, meaning an eye typically looks more attractive when from the inner corner to the outer there's a slight tilt towards the outer. When
Mhm.
it tilts downwards, it tends to look sad, and that's why with cat eye makeup, the eyeliner
Mhm.
goes upwards. And so when I'm designing my incisions, I design it so you get a slight flare at the end, which kind of opens
Mhm.
up the outer corner of the eye.
Right. Versus
I
bringing
wish
it
I had
down.
asked for that. Damn it. Damn it.
What about for people who don't want to go under the knife? They're not ready,
Mhm.
like me. What are you doing?
Like me.
No,
like
but
me.
what are you doing to see? Or is there anything that's impressed you, like with radio frequency or any other types of modalities?
I think it again depends on the face and what we're seeing.
Yeah.
So if there's skin quality, I think radio frequency is great. I love a CO2 laser.
Yeah.
I like PRP, PRF to the neck. Basic microneedling, I really love.
Yeah.
And then
It does make a difference.
yeah, it really does. And
Yeah.
it's something that people kind of glaze over now because there's so many new devices
Mhm.
out there. But
Mhm.
I think that makes a huge difference. I think consistency is key. So
Mhm.
even with the lasers, I laser my face probably every 6 to 8 weeks.
Yeah.
I do PRF under my eyes. I try to do every 6 weeks. I'm not always on time. So sometimes it's 3-4 months in between. But being consistent, I think, with like non-surgical rejuvenation
Mhm.
treatments is really important.
So like microneedling twice a year kind of thing or more.
If you could do it more, I would do
Yeah?
it more.
Okay.
Yeah.
Mm-hmm.
I know the
Interesting.
estheticians love the microneedling. I don't know.
It
that I've
really
ever
is
gotten it done.
great. Like
Yeah.
the pore size is so
Mhm.
much better after. The
Mhm.
acne marks are so much better after. It really is. Is there anything we haven't talked about today? And I know you're not trend based, but you're keeping your ear to the ground
Yeah.
and always learning. So tell us.
One area that most people come in early for, men and women, is the eye area. And it's a common area that gets neglected. But it's often because the skin is thinner, it's often the place in the face that people see aging the most,
Right.
the soonest.
Yeah.
So being, mindful of, eye creams, I think are really helpful. Making sure you're using tretinoin and retinol-based products is important. I do love kind of early Botox around the eyes.
Yeah.
I think there was a lot of, debate over whether or not it's
Yeah.
preventative, but I actually think it is. I think early treatment around the eyes with Botox and then early treatment with blepharoplasty is really key.
Okay.
And I'm doing a
like
lot
what
of
age
that
are
now.
we talking?
Even like late 20s.
Okay.
Yeah.
Yeah.
So late 20s, early 30s.
Right. Okay. Easier to get in front of it than treat it after the fact, right?
Yes. And especially for the eyes, just like the face,
Mhm.
as you get excess skin on the eyes, it'll crowd on this outer corner.
Mhm.
So if you do it early, you have less crowding here, which means you can keep your incision shorter. So if
Okay.
you wait too long, you have excess skin not over the
Right.
actual eyelid out here. You now have to take your incision out,
Right.
which will look more obvious
Okay.
down the road.
This woman is an absolute pro. Our last question for you. What are the 3 post-surgery or cosmetic enhancement products that you can't live without?
So this is going to sound very basic,
Okay.
but I actually think everyone should keep Vaseline at home.
Okay.
I think Vaseline is a really key product, especially for people that have overly sensitive skin.
Mhm.
So while I use very specific post-procedure creams after lasers, if someone's allergic, I always just put them on Vaseline. So that's one. Definitely my Naked Beauty MD eye masks and now face masks. But these were initially developed for my patients post-procedure. So after their eye procedures, whether or not it was surgical or not. So even
Right.
after PRF under the eyes, microneedling, lasers, but surgery, patients were using them to minimize swelling, decrease recovery time. But
Mhm.
then patients started to use them, and continuously use them after their procedures. And they kept telling me how, great it worked. And so we ended up doing a third-party blinded study, double-blinded study. And then after 1 week of use with 94 participants, so 188 under eyes, we saw 97% improvement in the under eyes.
I really do notice a difference
I love
with
that.
those. Anything else that's great for post-surgery or post-cosmetic treatments that's just like a must-have?
I love anything with growth factors and peptides in it.
Okay.
So just, I think growth factors and peptides we're going to be seeing a lot more of in
It's
our
just
our products.
exploding.
Yeah.
Mhm.
It's
Absolutely.
crazy.
Yeah.
I definitely think they're legit.
What's the
Yeah,
brand
definitely.
that has made the grade with you where maybe you've looked at their studies or whatnot?
Yeah, there's a few, but right now I do like TNS.
Mhm.
Oh, yeah.
by
TNS, yeah.
Schematica. Yep,
Mhm.
it is pricey. So for
Mhm.
some people, it's, it might be a little tricky, but I
Mhm.
do think it works.
Okay.
Well, thank you so much
Thank
for
you both so
spending time
much.
with
Learned a
us,
lot.
enlightening us. We will be getting our consultations. But thank you honestly so much for spending time. We know how in demand you are, and we really learned so much. So thank you.
Oh, well, thank you both for having me.
Thank
It was such a great
you.
conversation.